All right, welcome everyone. We're about to dive into what might just be the single most important skill you'll develop in your entire medical career, that very first encounter with a patient. You know, if you get this right, everything that follows, the diagnosis, the treatment, it all just falls into place so much more easily. But if you get it wrong, well, you're fighting an uphill battle right from the start. So let's really build that foundation.
So I want to start with a question for you. When does the diagnosis actually begin? I mean, is it the moment you ask about their symptoms, or maybe when you first hear their story? The real answer, the one that separates a good student from a truly great clinician, is often something we overlook.
Okay, before we jump into all the techniques and the how-tos, we need to get grounded in the why. It's a pretty simple question, really. Why are we here, in this room, with this person? Because the answer to that is going to shape not just your empathy, but your diagnostic accuracy for your entire career. Let's really unpack that.
You know, it's pretty amazing that a clinical textbook starts with a quote like this. It's such a powerful reminder that at the heart of all the complex science and all the data, there's a very simple, very human goal. We're here to help people who are suffering. And trust me, that's not just some feel-good line. It's the core idea that will keep you focused and prevent burnout down the road.
And this right here, this is the central challenge of medicine. On one side, you've got the disease. That's the science, the pathology, the stuff you learn from books. But on the other side, you have the patient, the human being who is experiencing that illness. Look, anyone can memorize the science, but a true physician, a real healer, learns to navigate both of these worlds at the same time. That's the art we're here to learn.
Okay, so how do we consistently take a patient's story and turn it into a clear, accurate diagnosis? We need a system, right? A reliable process? Well, this is it. This is our blueprint, the clinical method. I want you to think of it like your personal operating system for every single patient encounter. It's the process that keeps you from getting lost in all the details.
Let's just debunk a huge myth right now. You know that senior consultant, the one who seems to just walk into a room, take one look at a patient, and make a brilliant diagnosis? It's not magic, I promise. It's method. It's a structured process that they have mastered through thousands and thousands of repetitions. And the good news is, it's a skill that is absolutely learnable. So let's break down how you can learn it too.
So here it is. The so-called magic is really just this simple two-step process. Step 1, you're a detective. Your job is to gather all the clues you can from the patient's history and your examination. Then, step 2, you become the analyst. You take all those clues and you interpret them to figure out what's going on and make a plan. That's it. That is the entire clinical method in a nutshell. Gather, then interpret. If you can master these 2 steps, you've mastered the foundation of clinical medicine.
Now, let's talk about something that so many students miss, but I promise you, experienced clinicians never do. Your data gathering doesn't start when you ask your first question. No, it starts the second you lay eyes on the patient. Those first few seconds, before a single word is even spoken, are an absolute goldmine of clinical information.
And listen, this isn't some newfangled idea. If we look at the source text, Hutchison's, this principle has been central to medicine for over 100 years. The technology has changed for sure, but the core skill of just observing a patient and building that initial connection, that hasn't changed at all. It's absolutely timeless. This is a really important mental shift you have to make. Your examination starts before the patient is even in the exam room. As you call them from the waiting area, you need to be actively observing. How do they get up from the chair? Do they have a subtle limp when they walk? Do they look anxious? You are collecting vital clinical data from that very first moment.
All right, let's zoom in even more on those critical first 10 seconds. This is where your powers of observation are just everything. Before you even say hello, you have this incredible opportunity to gather a huge amount of information. So what should you be looking for?
Think of this as your mental checklist for those first few moments. First, check their demeanor. Are they relaxed or do they seem really anxious? Then, look at their eye contact. Is it direct or are they avoiding your gaze? Try to get a sense of their emotional state. Do they seem scared or maybe are there signs of depression? And don't forget to notice who they're with. If they have someone with them, that can tell you a lot about their support system or just how sick they really feel. Every single one of these observations is a piece of the puzzle.
So let's bring this all together. It's so easy to dismiss these initial observations as, soft skills. But they are the absolute foundation of your clinical practice. All your amazing knowledge of physiology and pharmacology is pretty much useless if you're working with bad data. And that data collection starts right here with these fundamental skills.
All right, if you're studying for an exam or you just need the high-yield takeaways, this is your slide. If you don't remember anything else, remember these 5 points. 1. Diagnosis starts with observation, not questions. 2. The clinical method is just 2 simple steps. Gather, then interpret. 3. The first impression and the environment are actual, valuable clinical data. 4. Your number 1 goal at the beginning is to build trust and build it fast. And finally, number 5, understand the person, not just the disease they have.
And I want to leave you with this quote from the text, because it just sums up the art of what we do so perfectly. It's about the skill to strike up a relationship of trust and confidence in a short space of time with a range of very different individuals. Being able to quickly build that trust with someone who is scared and vulnerable, that is the unique skill we're all trying to master. Get that right, and you'll go from being a good clinician to a truly great one.